Hi, it's a pleasure to be at the PPTC Northwell Pelvic Health Consortium ICA Patient Consortium. My name is Joel Stern, and I'm an Associate Professor of Neurology, Surgery, and Molecular Medicine at the Zucker School of Medicine at Hofstra, Northwell. The title of my talk is Inflammation and Immune Cells Involved in Pelvic Pain. What is inflammation? This is a 1799 illustration of gout. Gout is an inflammatory disorder and reflects how people thought of inflammation as a horrible monster that attacked your body. It was hard to see at the time the positive effects of inflammation, but inflammation is a protective response by the body. So what's the normal role of inflammation? This is a parade, and at the head of the parade is the marshal, directing or coordinating the band where to go. The role of inflammation is to marshal cells at the site of damage and to allow for rebuilding to occur and to regain health. So it's the marshaling of cells and fluids. Inflammation brings in the tools to isolate and destroy and remove damaged tissue and provide the foundation for healing, a balance or balancing of chemical mediators and plasma proteins. The process of inflammation is the same in all tissues of the body. If inflammation occurs at the connective tissue, it's the same at muscle tissue and epithelial tissue, as well as nervous tissue. So the process of inflammation and the cells that are involved in the process of inflammation are the same. It's just that they occur in different locations throughout the body. The connection between inflammation and pain is extremely complicated. Even though you may think or you may not see inflammation in the tissue, you can feel the pain as if the inflammation is actually present. But pain can last as the inflammation has subsided. This is an illustration obtained from a mouse ear, and the experimenter pressed the mouse ear to cause damage. And the veins are all these lines. All of these lines represent the veins, and these little dots represent the cells that are contributing to inflammation. And the dots exist in the blood vessels, and they're there to repair the tissue. So they're the cells that are summoned when inflammation has occurred, and the number of immune cells will actually increase. And this is on the left and the right side. You can see an increased number of these little dots, and every dot represents a particular immune cell. So what are these immune cells that are involved in the process of inflammation? Well, these consist of cells of the innate immune system, such as mast cells, neutrophils, monocytes, and macrophages, as well as cells of the adaptive immune system, such as T cells and B cells. But let's take a closer look at the mast cells. This is a mast cell, and what mast cells do is that they release histamine. And you may be familiar with this from allergies, and they also have a role in fighting infection. They release the histamines to signal other cells that they need to gather at the site of damage and try to fight the infection. And all of these are little vesicles where the histamine is packaged. And again, it's there to recruit immune cells to the site of injury and mediate the immune response. But in order for healing to occur, all of these cells that cause the inflammatory response, they have to be switched off in order to allow for healing to occur. And there are these chemicals in the body whose role is to activate the cells. And these are called pro-inflammatory factors or cytokines. And then there are anti-inflammatory chemicals that try to shut the system off. They shut the cells off that are causing inflammation. And this allows for healing to occur. Sometimes the process goes wrong, and one of these is a result can result in permanent inflammation in the particular area. So there has to be a balance. So the initial stimulus has to be removed. There has to be a decrease in pro-inflammatory mediators. And what happens if there's a failure? Well, this could lead to a Hunner's lesion, the formation of a Hunner's lesion, is interstitial cystitis bladder pain syndrome, and eventually chronic inflammation, where the Hunner's lesions continue to appear over time, even after treatment. So we studied certain immune cells, and we found certain immune cells at the site of the Hunner's lesions, and 47 biopsies were obtained and compiled for this data. And we measured the number of immune cells, in this case, the number of adaptive immune cells consisting of T cells and B cells and plasma cells, as well as the number of macrophages, neutrophils, and natural killer cells. And you can see that the number of blue bars were significantly increased compared to the number of orange bars, which represent the number of immune cells from an unaffected bladder tissue, as opposed to the Hunner's lesions, where you can see a significant increase. But this doesn't tell you the increase in the proportion of the number of cells compared to an uninfected bladder. And in this slide, you can see the whole bars represent the cells that are present in the Hunner's lesions and a healthy bladder. And these increases are in red, purple, and blue. And so these are the cells that are involved in the inflammatory response of the Hunner's lesions. So there was an increased number of B cells and plasma cells, as well as macrophages, that were contributing to the formation of the Hunner's lesion. In summary, inflammation can promote healing, but sometimes it can keep going on when it's not necessary and prevent the healing process from taking place. When inflammation occurs, you have an increase in the number of immune cells in the area of inflammation. And in Hunner's lesions, we see an increase in certain kinds of immune cells of the adaptive and innate immune system. And this gives us more information about the process that can contribute to the pathology of the Hunner's lesions and ICBPS. I'd like to thank Dr. Rob Moldwin for all of his help and guidance for these studies. At the Feinstein, where my lab is located, I'd like to thank Vishan Nursi, William DeGavia, and Michelle Laurent, as well as from Northwell Health, Mike Finaro, Oksana Yaksiv, Sonia Balani, and Suhel Najjar. At the Rockefeller, I'd like to thank Ina Tabansky for help with the analysis of the different immune cell populations, as well as Darren Keskin from the Broad and Harvard Medical School. I thank you for your time, and if you have any questions, please let me know. And I'd be happy to provide my email as well if you have any questions after this meeting.